All right, it looks like we are live. We'll wait a couple moments for attendees to join in. And so we'll give it a couple more seconds. All right, looks like attendees are coming in. And so let me go ahead and give an introduction. Hi, everybody. My name is Cory Lambertson. I am with Whitmix Corporation. And today I have the pleasure of introducing Matthew Davis on the screen with me today. And just so everybody knows, Matt Davis today is going to be covering a liner studio inside of Ortho System. And this is actually the second set of our quad series of webinars for Ortho System. And so, Matt, go ahead and introduce yourself.
Hi, my name is Matt Davis. I've been working with Whitmix for 3 months almost, somewhere in there, a few months. I worked in an orthodontic lab for 4 years before this. And before that, I had absolutely no orthodontic experience and didn't even consider this as a career field. But luckily, I had some friends that invited me to work with them and introduced me to this field and kind of fell in love with digital dentistry and orthodontics.
Awesome. Awesome. So Matt's been a great addition to our tech support and training team here at Whitmix. And so he's just brought a whole nother level of knowledge and expertise to the team. So we greatly appreciate his help. So Matt, before we get started, before I have you take the reins to this, if anybody has any questions at all during the presentation, please feel free to go ahead and type them in, ask them as we're going through. I do not feel offended in any way when I interrupt Matt. so, so, and I don't, I imagine he feels the same. So please ask as we're going through. And just a couple other housekeeping tips. If you need CE credits, this is a CE approved course. And so there will be within about 2 to 3 days after completion of the webinar, you'll receive an email notification on how to actually capture the credits itself. So, Matt, with that being covered, take it away.
It's my turn, huh?
Yep.
All right, let's pull up Ortho Analyzer here. And can you see everything good?
Yeah, I can. So you may have to. I can see where the meeting tab is. Yeah, you may have to shrink that one down a little bit. There we go. Cool. Perfect.
Alrighty. Last time we did these models. So these models are all prepared already through Ortho Analyzer, meaning they have a base and they have been cut down, so they're ready to print. So what I'm going to do is actually just take these models and we're going to go to the next step in the process for Aligner Studio. So from here, once you open it up, obviously you get to this landing page. This is the patient browser. We're going to need to find the case that we're going to be doing aligners on. In this case, it's the one we did last webinar. And so we're going to double click into here and it's going to pull up the landing page for the model set that we selected. So you can do this with any model set that you have for the patient. Doesn't matter if it's the first or last or somewhere in between. And it comes up here, and on the right hand side, you'll see all of the viewfinder options that we had before, all the same stuff that we had when we're doing the workflows. And then on the left hand side, you're going to have a bunch of different options. Um, if you're just starting out with Ortho Analyzer, a lot of this stuff you're not going to need to use unless you have specific needs, obviously. But for this case specifically, we're going to be doing the clear aligners. There's two ways to do aligners right now. This button right here that I have highlighted on the left-hand side is going to take us through the new Clear Aligner Studio. It has a few, it's basically they took what they used to have and then put it into a workflow. And the nice thing is you don't actually have to have these models prepared already. If you click on this button and the models are a shell or just a scan, it's going to automatically prompt you to go through that preparation stage first. And so then it'll take you through that whole step. And then you can click on it again and go through that aligner workflow.
Now, Matt, before you jump into the aligner workflow, if it's okay, I ask,
Mhm.
what are all the other buttons? I mean, I know I'm open up. We're going down a rabbit hole now,
Yes.
but what? I mean, you said we have all these other buttons. What are they?
What are they? Most of them are included in the preparation stage, or they're kind of additional things that I didn't use 90% of them probably for the 4 years that I did stuff in this program. But this button is going to pull up our patient browser. So if we needed to switch to a different case or a different model set, you could do that through that button. This is going to allow you to open up and import a DICOM scan or a cone beam scan if you wanted to do that. You do have the option to bring that into there. These are different ways to alignment. So if you had an open model set like this, um, you can click on here and it will help you align using that um, orientation of the models.
Hmm.
And then this one, if you, let's say you had a doctor or maybe an assistant, whoever's taking the scans. I'm not pointing any fingers here.
Yeah.
Um, but let's say you did have somebody who sent you a scan and the models both come in with the teeth oriented upwards.
Yeah.
And you can click on this button and it will take you into the alignment stage. So you can actually modify alignments. Um, there we go. So I can click and drag it if I wanted, or rotate using these orbs. And the orbs rotate based on your position of view. So you can
Yeah.
make all sorts of different adjustments to the alignment here if you need.
Yeah.
The preparation stage here, this is this one and the standard planes, the occlusion plane and the standard planes, that's going to be the same step in the preparation stage that we went over where it orients the occlusal plane and the sagittal plane.
Okay.
This is the segmentation of the maxillary and mandibular. The aligner workflow before they had that, you had to go through and do these manually and then come in here to the virtual setup.
Okay.
Like I said, the aligner studio is what they're calling it. It basically just took all of those steps and just put them into a workflow.
Okay.
And then added a few new features that I'll go over as well when we go through there.
Cool.
Um, this one, I've even had people training on 3Shape say that they know like maybe one doctor out of the thousands that they've talked to who actually have used this. A
Hmm.
lot of them are not sure why they're in there. Uh, it's just questionnaires. I'm not entirely sure. Do you know what this is actually used for,
You
Cory?
know, I gotta be honest. I don't know. Um, I don't know if if anybody out there that's watching the webinar, if you have an answer to it and want to let us know, that'd be pretty cool. I don't know if maybe this is like a pre-questionnaire that you're supposed to ask the doctor before you start making segmentations or um, changing the teeth. It'd be interesting to see if that's something that we could share with uh, the actual doctor pre doing the
Yeah,
actual
yeah,
alignment. It's almost something that should be like sent to him beforehand.
could be. Yeah, I'm not entirely sure. I just know that the three different trainings that I've had with 3Shape, they've all said in like two or three words what it does and then said nobody ever uses it. We don't know why they have it. I'm pretty sure they're going to get rid of it in the next iteration, but that was like 3 updates ago. So
It's kind of funny. I think we're gonna get rid of it, yet it's still here,
it's still here. It's probably just they leave it in there because it's in there. I don't think
right?
they've made any adjustments to it. This is to measure overbite. Um, and you can see here, this creates a cross sectional down here. So you can actually come in here and say, um, measure there, and you can see actually the measurement of your overbite. So if you needed to measure how much overbite or overjet there is, you can do that with this tool. Um, the dental arch analysis. This is one of the newer features that they added in, and I'll be kind of touching on this during their aligner studio.
Hmm.
Analysis reports. It's a lot of numbers. a lot of numbers that it's the same as the questionnaire. Like 99% of this stuff is not going to be used except for that 1% of people who really are looking for something very, very specific.
Gotcha.
um,
So in all reality, if you want to get into aligners, we have all those other buttons, but don't worry about it. You only need one.
you only need this one right here.
Cool.
If you do need to generate reports, you can use this button, but this is also included in the Aligner Studio workflow. The occlusion map and compare model sets. This I'm pretty sure just shows um, contact points.
Yeah.
So if you needed to see where your contact points are, you could do that. And then this one, I believe, allows you to compare model sets um, and showing the difference between them. I've never actually used this tool before, but
So that would be like after you created model sets for
like
the actual
aligners,
aligners.
and
Yeah.
yeah, you can come in here and compare the original to the you could do this dual screen and compare the original with your aligner proposal and send that to the patient or the doctor. And
Yeah, I could see how that could be helpful. I mean,
yep,
for the doctor's side, at least presentation wise, or if he was questioning your work or she was
yeah,
questioning your work.
yeah, exactly. So it's a tool. I believe that's a newer addition as well. But yes. And then you have your bracket placement, which if you're going to do indirect bonding, this is where you would go to do that. But we'll cover that in, I believe, the next webinar.
Yep.
And then down here, you have custom workflows. So in Ortho Analyzer, you have the ability to make custom workflows. Um, I never did. I didn't see any need because they already have workflows built around all of the different features that I used. But if you ever do have a specific workflow that you want to design, you can look into that in your control panel.
Very cool.
But that's pretty much it.
Now that
Any
I derailed the
questions?
webinar, let's go ahead and show us how to do a show us the aligner therapy
All
process.
right,
No questions at this point in time, so you're doing great.
cool. So once you click the button, the great thing is it saves all the preparation stages that you did previously. So in this case, it saved my occlusion plane that I made when we did the preparation. So I don't have to set that, but you can make adjustments if you'd like. And then here it is just asking to make sure that you have your interior and posterior sections if you want to change those. Um, I haven't found any real effect on whether this is further back or forward.
Okay.
But again, this Aligner Studio is fairly new, a fairly new addition to the Ortho Analyzer. So I didn't have this when I was doing back in my day when I was
Yeah. Back in my day when
doing
I
this.
used to walk to aligner therapy school,
Uphill in the
uphill both.
snow.
Yeah, uphill both ways.
So here's where the meat. So we're through all the milk. Now we're getting to the meat and potatoes.
Yeah.
Um, so this is where things start to get a little bit more intense, and you can start making mistakes. So I'm going to show you those mistakes. I'm going to mess up on purpose and show you more than likely what you're going to do if you didn't have somebody showing you what to do. So on the left-hand side here, you can see that we have this wisdom tooth selected, which the patient does have actually, which is not very common. But what you there's two ways of doing this. The cautious way is to segment every single tooth that is on the model. That works really well. But it is not very time efficient. So what you can do is right click on these teeth and declare them missing. And then the system's not going to prompt you to segment those teeth. Or what I normally do is I determine what teeth I'm going to be doing aligners for. So like in this case, let's assume that we're going to be making some minor adjustments on these anteriors, but maybe we want to try to correct that bicuspid there.
Right.
The rule, if you follow this rule, you'll never go astray really, is always segment the teeth adjacent to the teeth that you're wanting to make movements for. So in this case, most people would think, well, if I want to make a line segmentation and move this tooth, then I want to segment just this tooth and then I'm good to go. And you don't want to do that. because as you'll see later on in this workflow, I'll point it out there as well. But what this is doing is actually the computer is going to determine what is hard tooth and what is gum tissue. And anything that's not segmented as a hard tooth is going to be determined as gum tissue, which it can
Oh,
shift and morph. And so if you only segment this one tooth and then come in later on and move this tooth, what it's going to do is actually morph the canine and the other bicuspid to twist them to fit, like gum tissue would. So
that would
that's
not be
why.
ideal.
No, it's definitely not good, and not good for the patient when they try to put that aligner in as well. So what you can do though is I'm going to show you one of the biggest mistakes that I've trained several different people, and 90% of the time they make this exact same mistake. You can see over here we have this bicuspid selected, and if I come in here and click, it's going to ask for the mesial distal points to determine where the tooth is. But let's say that I accidentally click, or somebody's walking behind me and they bump into my chair when I'm about to click, and I set my mesial point here instead of where it should be. A lot of people, because those points are movable if you have that tooth selected, but in this process, the computer's trying to be efficient for you and saying, okay, we did this tooth, now show me this tooth. But
Right.
a lot of people don't realize that that's what's happening, and they forget, and then they come in here and try to click and move that mesial point and it didn't work, so then they click again thinking, well, maybe I didn't click it right. And now you can see that the computer thinks that that bicuspid is in this little teeny space right here, and it just is going to keep going around until it's
Until
done.
you have a stack of teeth on one.
Yeah.
Uh,
But the great thing about digital technology is we can just clear that tooth and it resets it. So we can come in here, we can click on this tooth and adjust the mesial point there. What you want to try to do, you can see I'm moving my camera around. I'm trying to get an occlusal view of the tooth as straight down the root as I can. Um, and the reason is because when we get to the movements are actually going to be based on the angle of that insertion. So you can see that red arrow is coming in straight. It's not really that straight. It's not too bad, actually. That's just a weird shaped crown. But if I were to have this set like this, and it's all sorts of not, well, it's actually not too bad, but if it wasn't set correctly, then when you're moving left or right or forward or backward, it actually is going to use this as a center point or a movement point. So um, that is something to be wary of, is to try to get it straight as possible, straight down the root of the tooth. So we'll go through here, and I do apologize. I am trying to move slower so that it doesn't chop up too much on your guys' end.
so we did have a question come through. I'm not
Perfect.
sure on what the question meant. Um, oh, actually, it looks like it was a personal message about trying to find the trainers' names. Never mind. It was not a question related to the actual webinar.
I see. I am actually going to come back here and segment these molars because they implemented, I don't know if you know this, Cory, but they implemented a labeling feature that is going to be really, really great for um, orthodontic labs and orthodontists who do these aligners.
What do you mean as a labeling feature?
I will show you when we get to the export stage, because when I saw this, it was demonstrated to me when I had my first 3Shape training getting hired here and seeing the new workflow.
Hmm.
And I was so excited, but I wasn't working in the lab anymore, so it didn't
Yeah.
matter.
Yeah. You're like, oh, sweet, this is gonna save so much. Never mind.
Nope, not going to save me any time anymore. But I know from firsthand experience that this is it's a really good feature that they implemented. So now the system, you can see these splines here. those are supposed to go right around the gum line of the teeth. And you can see the computer did not do a very good job of guesstimating where that gum line is. So we just have to come in and manually adjust those. Was there another question that came through? Or...
Yeah, so it looks like another question came through. It says, on molars and bicuspids, I have found segmenting should be on the central groove and sizal edge on the anteriors. Have I been doing it wrong? I see it missed on the margins or the gingival margin on the case on the screen. So you definitely want to capture the tooth completely around the gingival margin.
Yeah.
Uh,
But as far as where you put those mesial distal points on the molars and bicuspids, it can be in the center groove here. I don't know. I actually don't know the word for that canal here. And
so it'd be
they call it a corridor.
the central groove or occlusal
Yeah,
groove.
yeah. So it can be there. I've always just put it on the anterior cusps. That's just, I don't know why. That's just how I was shown how to do it, and that's how it makes sense to me.
Yeah.
But it doesn't actually make any difference.
Yeah, it just helps with proposing the proposal of the actual segmentation line itself.
Ooh, we got a
Yeah.
good little weird section here.
So I bet if you and the gentleman that's actually commenting, if you were to place it actually on the central groove there instead of on the actual cuss tips, it would actually probably mark those a little bit better for the posterior, I would imagine.
More than likely.
Yeah.
I almost always find the way, like the more complicated way to do things, and then just get faster at doing it the harder way.
Yeah. Yeah, there's little quirks with the software and little things, and usually after you use the software for some years, you end up falling in habits, whether it's good or bad,
Yeah, exactly.
and
I was gonna
and
say
it's
good
just
or bad.
yeah, good or bad, and it's like that for any sort of software you use.
Yeah. The trick is to be malleable
Yeah,
as just a person and be open to learning a different way, especially if you're using the software all the time.
right.
I was being open for somebody else who might have done something faster. I had several employees who I helped train. They came to me, months after their training, and they say, "Hey, I tried doing this way, and it's actually quite a bit faster. You should try it." And then I tried it, and sure enough, it was faster. And I was like, "Oh, cool. Well, thanks for showing me."
Then he corrected him and said, "Do it the old way."
Yeah, that's what I always said. I said, well, I show you guys, sometimes I show you a specific way to do something because it needs to be done that way, and other times it's just because that's how I was shown. So, anyways, so now that we've got all of those segmented that we want to do movements on, we hit next, and you can see down here at the left hand side, the bottom left, this is going to be where you see what the system's working on, and if there's a progress bar, it'll say how much is
That's actually
left.
kind of nice that it literally states what teeth is still working on.
Mm-hmm. Because it actually can run into problems, and it'll tell you which tooth it has a problem with, and it says, hey, the mesial distal points of this tooth could not be defined. Can you redefine them and
What if
stuff like
it's
that?
what if it states done and it's not moving forward?
Then most of the time you wait, like we are right now.
Yeah, that's what I was
It
like.
should go through. I've done it on this set of teeth before.
This is where good jokes come in hand.
Yeah. I'm
Fortunately, I don't know
fresh
any.
out. Yeah.
Yeah. So just to recap, so far, what have we seen, Matt?
um, Pretty much just the segmentation process.
All right,
Hey.
that was good. That was a long enough question to get through the next step.
Perfect. So this step, you can see here, these teeth they look just like the gum tissue. Just to reiterate, like what I was saying before, if we moved these molars at all, then um, it would morph those teeth. This sculpting step here, there is an option to sculpt the teeth here. The only thing that I've ever done in this step, because you don't want to anything you move or sculpt on the teeth here is going to reflect on the model when it's printed. And so what we want to really steer away from is removing too much of the model or adding too much of the model so that it doesn't fit at all, or it's so loose that it doesn't do any movements like we want it to. But there is one thing, if you're doing a lot of major movements, what you can do here is, that's the one. You can see here on the distal sides of the teeth, that's not what a tooth looks like on the distal and mesial sides. You can see how they have these sharp, flat edges. What I did was I just come through here with a very, very low intensity down here and soften up these edges so it's a little bit more natural looking.
I see you're using the subtract tool. Is it better to use the subtract tool versus the smooth tool, or
Um, I would I would probably say that's personal preference. I have a very not healthy relationship with the smooth tool. I'll be honest. I every time I've used it, it always comes out just too smooth, I guess, and I like a little bit of crisper of an image, but the smooth tool would work just fine on paper. Personal results may vary, right? Um,
absolutely?
but this stage is not needed. It can, if you're doing very drastic movements to a point where the distal points of that I'm making adjustments on here, if you're moving these teeth so much that these points are coming out or are visible, it might have some effect on your fit, but probably not. This would probably be more along the lines of if you're doing like a wax up or a proposition and you want some, and you know you're going to be making really big adjustments for those teeth. So, but yeah, so you can do that there. Again, be very cautious and careful as you go through with that. And then here is just the rotation center. There's no adjustments that you can make here, as far as I know. Oh, you can make adjustments on your what is this red arrow called, Corey?
Insertion direction
Thank
or
you. That
path of
works.
insertion.
Yes. So you can make adjustments here if you need to, but most of the time I take the extra time to just make sure it's set properly. Um, with the lower, the great thing about Ortho Analyzer is everything on the upper is the same as the lower. And we can turn on our upper, and our wonky tooth is over here. So I'm going to segment the teeth over here because we're not going to move these teeth, but what we're going to do is um, we want these teeth to be segmented so that in the system it recognizes that these are teeth and it will actually show us contacting points with the opposing teeth. So we want to make sure that we're not messing up the bite too bad. So, and it looks like the gingival line was drawn pretty well. So we're going to just go next. I don't need to worry too much about the lower since I'm not moving them. We don't have to worry too much about the details. We just want a general outline of where those teeth are so the system can tell us if we're contacting or not.
Gotcha.
And now we wait.
Yeah, so that's just back to that the idea of having a soft tooth structure or hard tooth structure.
Yep. So the system's not going to tell me if I'm moving the molars on the upper. It's not going to tell me if I'm contacting those because it just thinks it's gum tissue and it'll morph. So
Okay,
that's why you want to segment the opposing where you're going to be making movements.
gotcha.
If you have the opposing,
Yeah, you,
can't tell you
it sounds like you've had a couple of cases where the posing does not come through. So there
more
there is
than.
there is a checklist. So if anybody wants to get into aligner therapy, make sure the doctor at least sends the upper and lower casts, and
Yes.
if possible, a bite scan as well. Um, if it's
All
from
of these
an
things.
intraoral scan.
All of these things. So this is I don't really know personally why they had this implemented. They added this with the Aligner Studio. I think it is probably more useful for newer employees or people who need a little bit more hand holding during this process, which is fine. Or if you have a doctor who's asking for a very specific shape in their dental arch for the patient. But what you can do is we'll add one, and we're going to go to edit maxillary arch. And now I can draw a arch, an ideal arch that I want to match up with. So let's say the doctor said, "Hey, this patient has a little bit rounder of a face. I think they'd look better with a square arch." Or so we can bring these out a little bit more, and then it will actually create an overlay in the actual movement process so that we can use this as a reference
Hmm,
point. Like I said, not something that probably 99% of the user base is going to use because it is very beginner oriented, but it is there if you do have specific needs that can be met with.
yeah.
Same thing with the lower, but I'm just going to skip over that because we don't need to. And we hit next. Now we're getting to the aligners. Any questions up to this point?
Looks like you're doing great. So far, you're crushing it.
Cool. Um, we'll do some overview, I guess, here. Briefly talk about all the different tools. I will go through them all. This we start by default in the movements tool, which has kind of a lot of basic stuff involved in it. You're going to spend most of your time in aligners with this tool.
Yeah.
Um, one of the things they added was these three things here. So the ideal arch that we just created, you can see it creates an overlay. Um, I'm going to turn that off because we don't need it. The other two things are they added constraints, and these can be adjusted in the control panel. And again, I personally believe that this is probably going to be used more with people who are kind of new to the software or new to orthodontics in general, and maybe you're not comfortable with how much movement they're going to be performing. You can set constraints in the control panel. Um, these per aligner constraints will only allow a certain amount of movement per aligner, and the teeth constraints will only allow you to move the teeth in certain increments. So, and you can set a maximum range for that as well. So they can't move it past a certain amount, or every movement they make will be, let's say you have it set to to move in zero point 0.3 increments. You won't get a smooth rotation of the tooth. It'll move in zero point 0.3 millimeters as you rotate it. So it's a little frustrating, especially for somebody who knows what they're doing and wants a very specific location for the tooth. But it is there if you ever need it, or if you have somebody who's new and you want to help them along with giving them, kind of like bumper. I equate these things to like bumper rails when you're going bowling.
Hmm.
They're there. You can still bowl with them up and still bowl like normal, but they're there to kind of give you some confidence to get down the lane.
Gotcha.
Um, so moving up to these movement check boxes, we're going to turn on collision detection, and you can see a bunch of numbers started showing up and then some red points. Red points indicate contact or hard contacts. And these other points are telling me how close we're getting. So blue or gray is we're getting close, and red is we've exceeded the threshold. And you can actually change that so we can turn on collision threshold and adjust this to maybe zero point 0.2 millimeters if we wanted. This would allow uh, for instance, you remember I was shaving off the mesial and distal of these teeth in the um, earlier stage. Setting this collision threshold on would allow for some of that technicality to kind of be excused, if that makes sense.
Hmm.
So because these are not perfect renditions of real teeth, they have some flaws. um, turning up your collision or turning down your collision threshold, however you see fit, kind of will help alleviate some of that.
Right. So it's just like a
Uh,
threshold for air or natural air that can
yep,
occur.
exactly. Restrict teeth collisions, I always would recommend leaving that checked off, so not turned on, because it will not let you move a tooth if it is if that movement would be putting it in collision with another tooth. Um, I think it's just much better to be able to move the tooth and then make adjustments to alleviate that collision. So I will demonstrate actually. So if we take this tooth and move it over here, you can see I can stop movement and I'm colliding a bunch. um, so if we come over here and turn restrict teeth collisions on and try to move, you can see it won't let me move
Beyond.
beyond that point because we're colliding.
Hmm.
So another one of those bumper features that you can turn on if you so wish. I just have found that it is more restricting and cumbersome than it is helpful for my personal workflow. Um, the collision values are turned on by default. You can turn them off if you wish, or you can have them set. I'm not entirely sure what the difference is between this one and this one, but I think this one just shows all collision everywhere, no matter what it is. And this one might use your collision threshold, but don't quote me on that. And then band calculation. If you need to calculate a band, it does an okay job, I guess.
Now, is that band calculation? Is that more or less like overdraft or like any of these tools that would be overdraft for potentially for like the indirect bonding tray
Indirect
workflow as
bonding
well?
trays, or if you're making
Expanders, palatal expanders.
yes, so if you're making custom fit bands, then that tool might be useful for you there.
Okay.
But yeah, if you're making those things, then you don't need to really know what the circumference is because you are making custom fit ones. So, but yeah, if you're doing indirect bonding and you needed to know the size of the band, that could help you get in the right ballpark at least.
Yeah.
Um, gonna move through the tools really quick and then we'll do the alignment. This is the extract tooth tool, and I have heard from every single person who uses Implant Studio from 3Shape that they wish that Implant Studio extracted teeth the same way that Ortho Analyzer does. They said it works a lot better, and I think that's kind of funny that in this system they didn't just use the same one, but you can just select the tooth or teeth. If I wanted to select multiple teeth, and let's say the doctor, or if you're the doctor and you want to remove the teeth and see what alignment would possibly look like if you were to remove a tooth, you could do that here. Extract the teeth and wait for it to calculate. And there you go. Now it has a smoothed over gummy area where the teeth were. And now this will all be treated like soft tissue. So I could take this tooth, if for instance, and put it over here. But we're not going to do that. So you do have that um, tool to be able to remove the teeth if you need. This is this is the most controversial tool. Are you ready for this one? This is the equivalent of talking politics or
Yeah.
religion
Yeah.
in the orthodontic field right now.
Let's see what you got.
So this is the IPR tool, or stripping, depending on where you're from. It's interproximal reduction for anybody who doesn't happen to know what that is. So I'll tell you what interproximal reduction is, and then I'll tell you why it's not something you really want to use in this program.
Okay.
From my perspective, at least. I know it's in the system, so you can obviously use it if you want, but I have my own reasons as to why I don't think it should be used most of the time. So, interproximal reduction is shaving or taking a file or a sandpaper basically and shaving off edges of the teeth, right?
Right.
It's to create room, to alleviate pressure so that you can finalize movements.
Okay.
The system, though, does not apply IPR the same way that you would in real life. What the system does is very much what a computer would do, right? It takes the two widest points of the tooth based on your mesial distal settings and then shaves them flat, perfectly flat from those two widest points. So this tooth, we can do a nice demonstration. We'll do a lot of IPR on this tooth and hit apply. And you can see it shaved here and here. If I turn all the other
Yes.
teeth off, you can
Yep.
see where it applied that IPR.
Yep.
It's
Not the most precise way of doing it. I mean,
in fact, it is the most precise way of
yeah,
doing it.
yeah. Maybe it's
In a
it's
like
it's
to a fault.
yeah. It's overly precise. There we go.
Exactly. It's exactly what you would expect from a computer. And so I always have recommended not using IPR unless absolutely necessary because you can still print the teeth, you can still make all the movements and stuff even if they're overlapping, you can still move the teeth and print the models. But I have always recommended anytime I've talked with a doctor about doing IPR on a case, I always say, "Hey, if you need me to do IPR or show where I was doing the IPR, I can do that. But it's still at the end of the day, it's in your hands when you're chairside. You're the one that's putting these aligners in the patient's mouth. You need to be looking and seeing where those pressure points are and alleviate them as you see necessary, not me. I'm not the doctor here. You're the doctor. So make sure that the correct people are doing the correct doctor things and not you as a lab technician if you're doing these. It's not your responsibility to tell the doctor exactly how to be a doctor. That's my 2 cents on it. I know I told you this is the most controversial point of the entire webinar series, probably, but my recommendation is use it sparingly and only when needed.
Right. Make sure you double check it as well.
Exactly. And once you get to the reports page, it also shows what IPR you did on the mesial distal of what teeth. So you can send that to whoever is going to be doing the aligner so that they know, at least as a reference, that you did do some IPR. But we'll move on. Unless are there any questions so
Not
far?
at this point in time, everything's trucking along, so you're doing great.
Cool, cool. So this is the attachments. So if we select a tooth here, we can select what type of attachment we want. We click it on there, and then we can come in here and um, adjust it however big or small we want it, angled, whatever kind of torque or movements that you're trying to get. We can also move this in, all sorts of different things. So a lot of people see the different types of aligner adjustments that they have, and they want to do the same things. That's what I want right there. So they can do like a ramp type of modification like that. Um, one commonly asked question is, can I import custom abutments? And yes, you can. Uh, it is a little bit of a process, though. I'm not familiar with it. I know, Cory, you've helped people do attachments, custom attachments before.
Yeah, so it is a process. I mean, first you have to design the attachment, and there's a special X, Y, and Z coordinates that it needs to match to be able to work properly inside 3Shape. I believe you would want to look at it as if I think the y-axis or the x-axis is technically the z-axis. Yeah, it's a reverse way of thinking. And then when it pulls in, uh, then from there, there's it's really straightforward after that. But there's just a little bit of footwork you have to do to make sure that you get it pulled in properly.
Yeah. So it's possible if that is something that you have, you feel necessary that you need to implement into your system, just contact your reseller, more than likely us, and we can help you get that set up.
Yeah.
The distance map, I'm not sure. Let's see, show distance map. I think this is just showing kind of like collision points or collision values, how close you are to things. Never really used this. Did you use? Do you have you used this one before, Cory?
I have not. But that's what it looks like. That's what's giving us just a heat map, showing
Yeah.
the actual interproximal details.
Once again, another tool that 99% of the user base is not going to use. This one, measure points, this one was really necessary back in the day before they did all these cool updates. But you can select different points of a tooth, and then when we make movements on those teeth, you can see that it's showing me how much movement has taken place from that point's original starting point.
Yeah.
So used to be really, really helpful for when we were wanting to determine how many trays we were needing to create. But they've since the center points, this is going to be if you need to adjust where a tooth is rotating from. Again, not really something that I use too much. Most people I know never really used it either. And then this is the flexible tissue area. So this would be if you're having some problems with the tissue not calculating correctly, or let's say you're doing some really intense movements, moving the teeth very, very far, you can come in here and adjust the flexible area so that it will still maintain that flexible
So it'd make it
tissue.
look a little bit more organic.
Hmm. So, but then that's the general overview of all the tools. Um, let's move some teeth, I guess.
All right, let's see it.
So once you're got all your settings and everything, you're on the movements tool. There's a few different ways of moving the tooth. If I select a tooth just by single clicking, you can see over here there's this box on the right hand side. If I click into one of these numbers, I can type in a value that I want, and it will execute that depending on what it is. So in this case, it's a rotation, so it's going to do 32 degrees. Or I can use these little teeny tiny arrows, and it'll rotate in a whatever increment you have set up in either or in control panel, or you can change it down here. But that's one way. So I always have trained people the best way to do this is if you're going to be doing bodily movements to do with these boxes. So like left and right movements like that, or forward and backward movements. And
Okay.
then if you're doing any rotations or um, intruding or extruding, to double click on the tooth and then use these orbs. And I'll demonstrate exactly why we don't want to click and drag to move to do bodily movements. You can see if I move this, the box over here is going to update with the movements that I performed, right? The one I want you to pay attention to as I click and drag this is this intrusion and extrusion number. So if I click and drag, you can see it's actually moving up and down, not just in the way that I'm trying to move it, right?
Right. So it's gonna lock
And
in on the different axes.
exactly. And so the computer doesn't understand that you're trying to just move, you know, forward and backward. It's from your perspective, it doesn't, it's really difficult to explain, but we're working in a three-dimensional space, but we're using two-dimensional tools. So that's the best way that I've been able to explain it is we have a two-dimensional view and we have a mouse clicker and that's it. We don't have anything to physically alter a third dimension here. And so that's the best way to, to describe what's happening here. But it's pretty easily avoided if you just use these for bodily movements and then these for rotations. But we can set this up, get this tooth to kind of look a little bit more like it should. And then we can even come in here and turn on the lowers. We can turn off all the gum tissue if we want a little bit more vision. Um, and we can see, oh, okay, this is fine. It's going to be okay. Um, can turn the lower back off if we want and make any kind of movements that we feel like we need to here. Don't worry, this gum tissue, the more extreme movements that you do, the gum tissue kind of has a weird stretching that it does. I've never really had too many problems with it, but
Is there a way to like have it like have like the tissue unsnap and resnap, like so it doesn't give that swirl? No, did it?
nope.
Nope.
Oh, there
Okay.
it goes. Yeah.
Well, but the tooth
It,
rotated back to the default.
oh, that's right. It did. Yeah. No, as far as I know, it's just going to stretch like that.
Okay.
Um, but it shouldn't affect the fit at all because the tooth itself is still the right shape, so it should be fine.
It'd be kind of cool when you create your model sets if it would like detach, reattach the tissue,
Mm-hmm.
so it didn't swirl. You know what I mean?
Yeah. Yeah, for sure. Or if you could manually tell it to recalculate after you do a lot of movements. Oops. From here, it would just be some minor adjustments if you wanted to make them, but that's pretty much the gist of it. Um, we're kind of running out of time. Any other questions or things that you? I do have a couple of things still to go over the exporting process and labeling, but
Yeah, I
before I
mean
get to that,
we have time so far. I mean, go ahead and show that. And no questions at this point in time. And just to
cool.
recap, if anybody wants to have a one-on-one demo of this, just go ahead and reach out to our sales reps. And so that'd be Cassandra Dombrowski or Sherri Weatherby or Chris Fry. Just reach out to them directly, just so we can get your contact information. And then we can go ahead and actually schedule an actual demonstration of the software one-on-one and make it a little bit more personal with what
Hmm.
you're looking for.
Absolutely, and you can be a lot more like what Corey was saying, personal, and saying this is what we want to be doing, and then we can kind of cater that demo to show you a little bit more closely to your specific needs. Um, yeah. So from here, though, once you've got your teeth set up the way you want, what we need to do is tell the computer to separate them into different. They're called sub setups, but different models. So however many models we want to take from our original point to our finished product or our finished arch. And there's a couple different ways to do that. You can use the per aligner constraints, which you set up in the control panel. So if you're a lab and you have a doctor who has very specifically requested 4/10 of a millimeter of rotation per, or 4/10 of a millimeter bodily movements and maybe 5 degrees of rotation maximum per aligner, you can set those parameters up and then just click on this button and select that doctor, and it'll automatically separate based on those parameters. You also could come up here and tell the system how much rotation and how much movement you want per tray. Or you can just tell the system, I want 10 trays. And then it tells you how much movement is happening per setup there. So I'm going to do the 10 trays, which is quite a bit. And then one of the newer features, this is a really cool feature. I really like this feature a lot. Um, is this timeline? I don't. Have you seen this, Corey? Have you showed people this yet?
I have seen it, but I don't know much about it. If you want to go ahead and give us a tour of it, that'd be sweet.
Yeah. So the coolest part about this, and I wish that they had done this a long time ago when I was actually doing these for a living, is you can adjust when a specific tooth's movement is happening in relation to the whole series. So this happens a lot more in a lower set of teeth in the mandibular than it does in the anteriors. But let's say you have teeth that are overlapping, right? One tooth is in front of the other, but you need to push that one that's behind out to create room. And so what you actually can do is have all of the teeth move except for the one that's in the back first. So you can create all that room that you need and then have that tooth move out when there's actually room. And the way that you can do that is by selecting the tooth here. And this whole green bar is all the movements that are taking place from 0 to the last step. So you can click and drag down to whatever tray you want. So now tooth number 8, all of its movement is going to be happening in the first 2 trays. And then we can click and drag the other direction if we wanted for tooth number 9 and 12. Now all of their movement doesn't even start moving until tray 2. Um, so it's really helpful for those cases like I was talking about with overlap, where if you need to make movements on a specific tooth or set of teeth first in in a series before other teeth are allowed to move, this system really helps with that.
That's pretty sweet how you can control the movements like that. I mean, it just makes sense.
It does. This is the combined. You can come in here and do more specifics
Right.
if you need, but yes.
I want all my teeth to move all at once in one tray.
Yeah. I want
Imagine how.
my patient to hate their life
Yeah.
for the next 3 weeks.
What about, so I know there's like different processes for moving. So like I've seen some studies say to move the teeth, I guess slowly, or so like use like a tray for like a month, and then you do it in increments like that. And then I've seen where some people, or some recommendations of doing a tray every 2 weeks, like expressing it. Now I feel like the express version would be damaging. Do you have any insight on that at all?
I don't have any real professional training on that specifically. I do know that it has to do a lot with bone growth and bone density. So it should be the doctor doing cone beam scans and actually, looking at the patient's bone and understanding their specific instance. But I do know that if you do too much movement too quickly, it will relapse more aggressively. But, we live in America and we want everything now. So
Yeah.
we do the express version all the time.
I want my teeth straightened out. I'm gonna also turn them into bleaching trays too. So I'm gonna fill them up with
Exactly.
bleach, throw them in. In 2 weeks, I'll have the perfect smile.
And then 4 months, my teeth will fall out.
So we got.
But
So on the next series, we're gonna talk about 3D printed dentures. Now,
yes, exactly. It's all full circle. We did, I think we recommended every 2 to 3 weeks for our trays, and we did 3/10 of a millimeter per tray. So that was our kind of standard of practice, I guess, at the lab that I worked at. But it just depends. Some doctors come in and they're very frugal or their patients are very frugal and they want those trays as small amount of trays as possible. So we had some that were asking for like half a millimeter per tray, and we advised them not to do that, but we're not the doctor, so we made it anyways. But I digress. So the one more feature that I have to show, and this is probably my most excited feature. I'm just like a giddy schoolboy when I found this out. Is the labeling feature, and this is going to save so much time and money because I know at the lab I worked at, we actually paid extra money for a third-party program specifically just for labeling.
oh wow.
And so the reason we did was two things. One was it allowed us to actually label our logo on our models. So we had a negative of our logo, which is a little vain, but
Uh,
that's what we did. And two was because we wanted molar numbers for our aligners. So on the tray, then if you have a number imprinted on a tooth, and then the suck down material will actually have a ghost of that number. So they don't have to have their models. They can just have their tray and it tells them what number they're on.
right.
They made that possible here, which is fantastic. So we can select right now, it's on the molars, and we're going to do tooth number 6. And you can see right there the number, and I can add a different
Now I have a.
system. Go ahead.
I have to ask this question. Can you invert the number and make it negative?
Yes.
Why? Why?
Why?
Yeah. Why would you? Why would they allow that? Wouldn't you want it to be a positive?
Oh, maybe you can't. Maybe you can't. On the ID tags, you can, but not the
Okay.
molars. Not the molars.
Okay. Thank goodness. All right. I was just waiting for the flood of phone calls of.
Sorry. I knew the tags for this one would let you go negative. I guess not for the molars, which makes
Good.
sense.
Good. Good.
That would
Good. Good.
affect the fit, but this also will affect the fit. But it's just going to make it a little loose on those molars, so
Yeah.
it's not too bad. But the cool thing is you can see how this is a red number, an underlined number. That means it's built into the system. and it's going to change based on every single number. So if I click down here on sub setup 1, it's going to change to 1 to 2. So it's automatically taking care of the labeling for all of your aligners. And as long as you use the red underlying system here, it's going to update based on that specific sub setup. So for this one, we decided we wanted to do these numbers. Maybe you have an internal numbering system, and then you can have the patient's last name. You could come in here and do sub setup title, number, and then all this other information. If you have it in the system already, it will automatically add it to the label.
That's
So
pretty cool.
it is the coolest feature that they've added in a long time, I think. So yeah, and then you just hit export. I'm not going to click export because it takes forever on my computer, um, especially with 10 sub setups. So that is the downside. It'll take a little bit of time to export and label all those, but then they're all done and ready to go. So
So from here, let's say we exported them. Where will we find the STL file at again? And I
in your ortho data folder, wherever you have decided to share that, I can share mine if you'd like.
think you'll have to reshare or add in an additional
There,
share of the
you
screen.
see my
There we
file
go.
explorer now.
Yep. Hmm.
Cool. So by default, it's going to be in this program data folder right here. And you might not see that on your side. You'll have to come up here to view and have hidden items checked on because it's a hidden program folder. Has a lot of like Windows specific
Oh,
things in here.
I just
So
learned something new.
yeah, so if you're looking most of the time by default, this is what you're going to see. If you check that,
Then you can
you
view
go
the
into
program data. Very
program
good.
data, 3Shape, and ortho data, and this is your database. And we did Jane Doe, beginning models, and go into models. And if I had exported them, there would be a virtual setup folder here showing all of those models there.
So from here, we have our models. We're going to go to your 3D printer. You're going to nest them. You're going to 3D print them on an Asiga printer or a Varibuild 3D printer, of
Yeah,
course. And
obviously.
yeah, obviously. And then from there, you'll post process and then do your vacuum forming. And then you have your liners.
Yep, that's it.
Very, very cool. So let's go ahead and we'll wrap up. If anybody has any questions, please feel free to ask. We'll have a couple more minutes. Sorry for going a little bit longer. There was a lot of really cool new information that Matt shared with the Aligner Studio. And just to recap, if you need CE credits, this does qualify for CE credits. It will be, you'll receive an email in about 2 to 3 days for that. And then what's coming up next, I believe the prospective date, and we will send out an email notification for this, is I believe it's on January 12th, and we are going to be covering indirect bonding trays. So let's say if the patient doesn't fit for aligner therapy, we can go ahead and squeeze them in with some brackets. And
Yep.
so squeeze those teeth right in there with some brackets.
Yep.
Um, and let's go ahead and see. Okay, looks like we have a question. Up, guys. Um, it looks like we had a colleague from 3Shape actually watching in. She says, "I taught you guys well." Winky face. So thanks for the comment, Maria. We appreciate your time. We appreciate your training as well. All right, so let's see here. Um, let's see. Looks like that is it. So thank you all for attending. Matt, do you have any closing remarks before I end it?
Nope. Just if you're thinking about getting into orthodontics and digital orthodontics, the best thing to do is just to get in and start getting your hands dirty. You're not gonna. I mean, watching webinars and getting trained on it is all fine and dandy, but there's just nothing that can replace the experience that you get just by jumping in and starting to try.
Absolutely. So from Matt's mouth, you heard it first. If you want to get into it, get into it. That's the only
Just do
way.
it.
That's the only way. All right. Well, thank you all again so much for attending the webinar here today with Whitmix Corporation. Once again, I'm Cory Lambertson and Matt Davis. Thank you for your time. And if anybody wants to see any more, you know how to get a hold of us, and we'll go from there.
Yep.
Take care, everybody.
Bye, guys.